the ACA and the effects on young adults. Objectives of the ACA: make health insurance coverage more secure and reliable for Americans who have it already. Make coverage more affordable for families and small businesses. Ensure access to quality, culturally competent care for vulnerable populations. Strengthen and modernize health care. Where do I stand on the ACA? I feel as though there are a lot of negatives for ages 26 to 30. For one, it is costly. All will be forced to buy health insurance or pay the penalty. Young adults will also have to pay at the same rate as elderly and the non-healthy. Will young adults be able to afford health insurance, or will it be cheaper to pay the penalty? Here I have a graph that shows the median annual earnings of full-time, full-year wage and salary workers ages 25 to 34 by educational attainment for the year 2011 to 2012. 43.6% of young adults fit into this category. Cost. All non-exempt Americans will have to purchase health insurance or pay the penalty. ACA is depending on young adults to purchase insurance to even out the whole of the healthcare market. Premiums will also rise for young adults. For example, in Indianapolis, the sticker price for the cheapest bronze plan for a 27-year-old male will be $204. Right now, he can get a policy for as little as $52.50, according to eHealth Insurance, which is an online marketplace. In Fort Lauderdale, Florida, the least expensive bronze plan will cost a total of $128 compared to $66 currently. Young adults will also be charged more to make up for people who are unhealthy and the elderly. It is also illegal for insurers to offer a policy geared towards a person's actual risk, meaning that whether they are low risk or high risk for health, they will be charged the same. What is the cost of penalties? The penalty in 2014 will be calculated in one of two ways: 1% of yearly household income, or $95 per person for the year. You will have to pay whichever one amounts higher. Penalties will also increase each year. So in 2015, 2% of income, or $325 per person. These penalties will be taken out of tax returns. Exemptions. There are many exemptions for not paying the penalty. A few that I will list is that if you are uninsured for less than 3 months of the year, the lowest price coverage available to you would cost more than 8% of your household income. You don't have to file a tax return because your income is too low. You're a member of a recognized healthcare sharing ministry, or you're not lawfully present in the U.S. And as you can see, there are quite a few more. Who is eligible for tax credits and subsidies? One will be able to find out if they were eligible after filling out the marketplace application. Savings depend on income and family size. The lower your income within these ranges, the more you'll save. So for example, if you make $11,490 to $45,960 for an individual, you will be able to save more and get more towards tax credits and subsidies. With the expansion of Medicaid, people falling in these categories may also be eligible for Medicaid. Using the subsidy calculator on kff.org, I was able to figure out the subsidized exchange coverage for a person that is 26 years old, single, non-smoker, making $30,000 a year, and no employer coverage available. As you can see, the household income in 2014 is 261% of poverty level. Maximum percent of income you have to pay for the premium, if eligible for a subsidy, is 8.37%. Health insurance premium in 2014 for a silver plan before tax credit would be $2,596 per year. If you could receive a government tax credit subsidy, it would be up to $84 per year. There are some positives of the ACA for young adults. For one, you can't be denied insurance if you have a pre-existing condition. You won't have to deal with high deductible plans that don't cover things such as mental health, brand name drugs, or prenatal care. There is the Medicaid expansion that many states have agreed to. And for people who already have insurance, there will be caps on how much you will pay out of pocket and free preventative care. In conclusion, premiums will increase drastically for young adults. For many, it will be cheaper to opt out and pay for the penalty. Costs may be too hard on people who may just be starting out and trying to pay off student loans, car loans, or even possibly mortgages. Young people do not need the same coverage as the elderly and unhealthy, so why pay the same rate? Thank you for listening.